This is breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.
Good morning, everyone. I'm Renee Summerhour with the Las Vegas Review-Journal. We're getting ready to take you live once more at the Southern Nevada Health District, where children are starting to get their COVID-19 vaccines. This comes after the Food and Drug Administration authorized kid-sized Pfizer doses for children 5 to 11 years old. Take a look.
Vaccine will be offered at multiple health district locations across the county, and also pediatrician offices, other medical offices, as well as pharmacies. The health district encourage parents to bring their eligible children to be vaccinated. We must say that in Clark County, more than 37,000 cases of COVID have been reported among children. 260 children 5 to 17 years old have been hospitalized here in Clark County, and unfortunately 4 children have died because of COVID here in Clark County. Regarding children 5 to 11 years old, there have been more than 7,000 cases in Clark County. There we have more than 150 children 5 to 11 years old admitted at different hospitals in the county, and unfortunately we lost 1 child because of COVID here. We also want to mention that in Clark County we have more than 200,000 children who are 5 to 11 years old. We also encourage parents to contact the pediatricians, medical providers, and ask them for information about the vaccine and how best they can protect the children. We also want to say that the vaccine that has been approved for children 5 to 11 years old, this is a vaccine that was already tested in the field in volunteers, and the data was reviewed by the FDA and the CDC, and this vaccine is considered safe and effective for children. And before I introduce our board members, I again want to stress the importance of children to be vaccinated, and especially parents to look for information, whether it is with the health district, with the pediatricians, or other healthcare providers. And I will introduce now Mr. Scott Blatt, who is the chairman of the Board of Health and also councilman for the city of North Las Vegas. Scott.
Good morning, everyone, and welcome to the Southern Nevada Health District. As Dr. Ligon said, my name is Scott Black. I'm the board chair of the District Board of Health, and as you can see, there's a great deal of passion and excitement and interest on all sides of this matter that we're here to discuss. But as the board chair and as a father, I'm very excited that the vaccine is now available to young children in our community. Vaccinating children is an opportunity to ensure that they can stay healthy, continue in classroom learning, and return to their pre-pandemic lives, which is really all we want. We know that the COVID-19 vaccines are safe and they help reduce the transmission of the disease. Vaccine is available throughout Clark County. I repeat, it's available throughout all of Clark County. It's very easy to access. As a health district, we want to ensure that everyone who wants the vaccine, and I don't know if those people can hear me because they're talking very loud, but whoever wants the vaccine, we want to make sure that it's available. Not everybody wants it, but those that want it can get it. We want to ensure that everyone also knows that it's safe for children, and the parents that want it for their children can get it here as well as throughout the community. The new vaccine eligibility for children, we believe, and I believe, is a win for our entire community as a way to ensure parents to know that their children are safe, and it's one less thing for the parents to worry about. Every step that we take as we continue to wind our way through COVID-19 and get through this pandemic is one step closer to ending it. I've seen through the data that the vaccine for all ages, now available for 5 and older, will lower disease transmission. It'll lessen COVID symptoms for those that do get infected, and it reduces hospitalizations from COVID-19, and ultimately, people don't die. It saves lives. So with that, I would like to introduce the Vice Chair of the Board of Health and Councilman from City of Las Vegas, Councilman Brian Knudsen. Councilman Knudsen.
Well, I appreciate the opportunity to be here. I have the fortune of representing this area in the City of Las Vegas. But I asked to participate today in this conference, knowing what the potential for protests would look like. And I'm looking right in the camera because I'm a father of 2. I have a 6-year-old, I have a 3-year-old, and this is what we've been talking about for over a year now. I remember when the vaccine first became available, the very first question I asked was, can I get it for my children before me? Because this is a scary time, and for parents out there that are wondering what to do for their children, no matter what side you fall on, you want to make the very best decision for your child. And you have to agonize over everything you do and question everything you do because you're thinking about what is in the best interest of your child. I have the exceptional privilege of knowing a lot of doctors. I have the exceptional privilege of working with physicians here at the Southern Nevada Health District, working with infectious disease doctors throughout the valley. And so the first question that I had when this became available for my child was I called them and I said, would you vaccinate your child? And so they said yes. It makes sense right now. And so at 4:30 p.m. today, I'm going to bring my 6-year-old in with another infectious disease doctor who's bringing his 5-year-old in, and we're going to do it together because my son and I have been talking about it for many, many months now. We saw Big Bird talking about it. We saw Grover talking about it. Or he has a lot of questions. I have a lot of questions. But what we know right now is that this is the right thing for our children. And so as a father, for every other parent out there that's agonizing over decisions for your children, I feel comfortable making sure that my child is vaccinated. And as soon as it's available for my younger daughter, I'm going to do it for her as well. And so that's my message to those who are listening, is if you're a parent, I agonize it just as much as you are agonizing it. I called on professionals and asked them for their advice. Their advice is they're getting their children vaccinated just like I'll get my child vaccinated. And so there's a lot of turmoil as a parent. It's just every decision is super hard. This one became easier when I realized that professionals are getting their children vaccinated as well. So thank you very much for the opportunity to talk about my story.
Thank you. Okay, I will call now Dr. Love, who is our Chief Medical Officer, and Joanne Rupiper, who is our Chief Administrative Officer and also leading our vaccination campaign for questions that you might have. Thank you.
So, any questions?
Yeah, Dr. Lowe.
Yes.
You can step up to the microphone. Obviously, you hear the protests, and one of their main objections is the safety. They feel that this has been rushed. Could you walk us through again how safe and effective these vaccines are? Talk to me about the dosing for the children, but specifically address the safety.
Sure. So, like all vaccines, they undergo very rigorous clinical trials, which means that they provide the vaccine to a large number, in this case, of children in this appropriate age group. They study both the safety and the efficacy of the vaccination. They look at potential side effects. And then they also, in this particular case, they use different doses of the vaccine to determine what the lowest effective dose would be in this particular age group, and they determine that the dose would be 1/3 of the dose for older kids and adults. So this age group, 5 to 11, is getting 1/3 the dose that's provided to older kids and adults. That dose has been determined to be very safe and very effective.
Were there any deaths during those clinical trials?
No deaths have been reported in the clinical trials, no. Have any deaths been reported in children from the vaccine itself? Not to my knowledge, no.
you talk a little bit about the dosage? Say, like right now, it's currently approved for 12-year-olds, but for 11-year-olds, they're going to be getting the mini dose. There are some parents out there wondering, is the full dose okay for their 12-year-old that only just turned 12 a week ago? Can you talk us through about kind of the difference in the dosage for that specific age range and whether it's safe or not?
Yeah, again, just follow the recommendations of the FDA and the CDC and of the manufacturer. If your child is 5 to 11 years of age, you get the smaller dose, and if your child is 12 or older, you get the full dose. Sorry.
Okay. So your question is about the allocation we got from the
When
federal?
we got them, the time frame. Why
When?
did we get them later than other states, perhaps?
Right. We received our vaccines last week. ASAP approved it Friday. And then we took this time to make sure that we train our staff and that we had all the processes in place for parents to bring their children in. So we wanted to make sure that our staff really understood how to give the vaccine and the correct dosages. Correct. We have the adequate supply, and we'll be able to order more as well. Yes.
How has the uptake been so far? Are we getting a lot of interest? Do you have numbers you can share?
Well, we've certainly had interest. We've had families calling and asking for the vaccine. We just started today, so, and a lot of our clinics are later, at some sites. So we're not sure about the uptake. We haven't really heard from our partners how the uptake has been so far, so it's a little early.
How busy is this location than was in Pfizer? And you have children here today.
Right. I'm not sure. I don't have that data with me and how much people they had this morning. Yeah, there are a lot of good resources on CDC and immunize.org on how parents can help their children cope with the injection. So a lot of things have to do with distraction, preparing the child, holding them close, and just like we do for other vaccines. I didn't hear it, did you?
How many doses do we have here?
Oh, how many doses of vaccine? I know we had ordered about 5,500. We had ordered 6,000 originally, and then we had given some to our partners. I believe our allotment for Clark County was 21,000. Right.
And that's for the younger children.
Yes, only 5 to 11.
What's your recommendation for parents coming up for the Thanksgiving holiday that is coming up? It looks like if the children get their first dose, they won't be quite fully vaccinated by the time the Thanksgiving holiday comes. What's your recommendation for them? Because
Well, it's a good time to start now. You want to do it a week or so before there's any type of event. So it's important to get it now and then get that first dose in, and then in 3 weeks later, they can get the second dose and now be ready for the other holidays.
Are children susceptible to side effects? I mean, some adults reported like sore.
Right.
Some, got sick a little bit.
Yeah.
Have you seen that in children? Is the study showing that that's happening to children?
Yeah, the side effects that I understand that they are about the same as for children as adults. Sore arm, pain and swelling, possibly fever, and parents should check in with their physician if they experience any of those signs and symptoms. Do you have anything about side effects?
The same as.
The same, yeah. Any what? Children death?
Childhood deaths.
No. I would expect that with the disease. We know that children can die of COVID, but not from the vaccine as of yet.
Any update on the mask mandate? Where are we at with vaccination rates?
Do you have anything on that? Mask mandate?
Current rates.
Thank you. No, the mask mandate is something that is, it's something that is again under the state recommendation. So, the state has already guidelines regarding that, like 8% positivity rate and the number of cases reported. So far, Clark County has not hit that level yet. So.
I just want to be clear, to be considered fully immunized for the kids 5 to 11, it's the same thing like adults and older kids, correct?
Correct. Yes, it's a 2-dose series, 21 days apart. It's only the Pfizer vaccine.
And then the 2 weeks after you get the second dose.
Pardon?
The 2 weeks after you get the second dose.
3. Yes, they're considered fully vaccinated. Correct.
Okay, that'll be the last question right now. If anybody would like to do some individual interviews, because it's a little difficult to hear, so let us know. And then I do need the pool photographer for inside this Channel 8, and I need the Las Vegas Sun still photographer. Is he here? Where is he?
So hopefully you just heard from Southern Nevada Health District officials. It was very hard to hear as protesters with megahorns, as you heard, are currently protesting the availability of the Pfizer vaccine for children in age groups 5 to 11. This is something that was not approved essentially from the Nevada Health District, but from the CDC. And the FDA. So obviously there are members of the community who are opposing the fact that this vaccine is available for children age groups 5 to 11, while others are excited, as you heard one man saying he couldn't wait to get this for his younger children, and that they plan on doing this together with some other members of the health department who were also skeptical at first, but now all believe this is the right decision and want to do what they believe is best for their kids. Again, the opposing view is that they feel like the vaccine could possibly kill those who take it, including children. And as we continue to talk about this, we've heard a lot of opposing viewpoints for and against the vaccine, especially for young children. But as a health official said, this is your choice. If you don't want to get the vaccine for your children, you don't have to. But if you want to, it is available. We will have much more for you on this developing story online at lvrj.com. We will also have an update on all of today's events for you this evening at 7 p.m. Remember, you can also download our free RJ mobile app to get breaking news alerts like this sent to your phone. And as always, you can find us on Roku, Apple TV, YouTube, and your favorite digital platforms. Thank you for watching.
You've been watching breaking news from the Las Vegas Review-Journal, sponsored by Michael Gaughan's South Point Hotel, Casino, and Spa.